Good morning, everybody. So today we're going to talk about aging, and we're going to go over the Gerontology PowerPoint from Rosedale's book about nursing. So I am going to share my screen with you guys, and we're going to get started on this PowerPoint. Away we go. And I'm actually going to pause for one moment. Okay, now we're going to get started. So here's our PowerPoint on gerontology, the aging adult. All right, so they differentiate between a young old adult and an oldest adult. So a young old adult is somebody who is between 50 and 79 years old and has what they call the normal biologic effect of those years. I hate the word normal because it's a very ambiguous word. Normal to you, normal to me. Normal doesn't always mean the same thing. But there are some things in general terms that happen to everybody with age. So we'll talk about those. Then we have the oldest adult. These are people 80 years and older. And, physical and psychological effects of aging are going to catch up with them. And then some of the difficulties related to those physical and psychological effects of aging. So we'll talk about those. So first, we'll start with ADLs. So most older adults are active and healthy and able to perform ADLs, right? They can eat, they can dress, they can walk, they can talk, right? Bathe. And IADLs, these are the things that you need to do, like driving to the grocery store, right? And buying groceries, managing your income, writing checks out, paying bills, all those kinds of things, right? So most people that are older are able to do these things for the most part. So what is gerontology? Gerontology is the study of aging, basically, the effects of aging on the human being. Geriatrics is the branch of medicine that's all about aging and the older population. And then you have gerontologic nursing and geriatric nursing, which are in essence the same thing. But like everything else in medicine, we like to give things a bunch of names to confuse the heck out of you, right? So nursing in the 21st century. I am a baby boomer. 1963 was pretty much the last year for the baby boomer generation. So the highest number of people, these are people born between 46 and they say 64, most sources say 1963. And we're living to be 85 to 100. Yay! I got years left. The social, financial, and healthcare needs affect other people. So in other words, if there was something wrong where I became ill, I have 3 kids. My 3 kids all have families, children, right? So are they going to be able to stop what they're doing and help me out? Right? You know what I mean? So this is the problem that we have, that a lot of these folks, if they do have family, the family's torn between I have little kids and I have aging parents. It's called the sandwich generation, what they call them. Or they don't have family, and then they wind up alone and sometimes wind up in a nursing home, which, all right, common changes in aging. These are the common things that happen to most of us when we get old, not me, everybody else. So the function of your organs is going to decrease, okay? Reaction time may decrease. Like if you see something coming, you should be able to, right? Sometimes they can't. Tactile sensations, in other words, tactile is touch. So they're decreased because of nerve endings, right? The nervous system is getting a little older, a little slower, so they don't always feel things as they should. And then decreased capacity for recovery. Because everything is slower, right? Every organ is a little bit slower. You get sick, you contract some kind of a pathogen, it's going to take possibly a little bit longer for you to recover from that. Visual and auditory changes, right? Not as sharp. When they say changes in visual and auditory acuity, not as sharp as, it was when they were 20. Like I said, everybody else, not me. Decreased reaction time, unsteady gait, sometimes decreased sense of balance, and stiff joints, right? Arthritis. Arthritis is osteoarthritis. Osteoarthritis is a disorder where it's just from wear and tear on the joints. You've been using your hands, your knees, your hips, your ankles for how many years? and the parts are starting to wear out a little bit. Increased emotional, socioeconomic, and physical losses. The sad thing about getting older is the older you get, the more people and animals and stuff die. And that's just part of this. And you have to be able to deal with it. And it's sometimes not easy. And then chronic illnesses. A lot of, folks my age have congestive heart failure, hypertension, whatever. Hard to cope with chronic illnesses. Poor dietary habits. You are what you eat. And lack of exercise. Sitting is the new smoking. I can't say that enough. You have to move. Okay. So now I'm going to go through every one of these systems, and I'm going to talk about the effects of aging on these systems. So we're going to start with the integumentary system. And we've kind of talked about that before. The integumentary system, as we age, you lose collagen in your skin. Collagen is what makes it supple and elastic, right? When you lose collagen in your skin, you lose elasticity, you're prone to wrinkles, but your skin also becomes more fragile. Us older folks bang their arm and they've got a skin tear, right? So that's part of, the integumentary system and its aging. The musculoskeletal system, like I said before, with osteoarthritis, that's one effect that comes with aging. The joints are just worn out. They've been around for a lot of years. Also, for women particularly, postmenopausal women are at the highest risk for osteoporosis. And the only way to prevent that from happening, or to help prevent that from happening, is before menopause, when you're younger, to build some muscle, right? Because building muscle helps increase your bone density, which helps to ward off osteoporosis when you get older. Okay. The nervous system, again, everything slows down a little bit. So when we talk about nerve cells in your body, you have nerve cells that send signals from the brain to your body, and then you have nerve cells that send signals from your body to your brain. If your hand gets near something hot, woof, you move it, right? You feel the heat. It's almost involuntary, right? Because it's sending the signal, you're going to get burned, move your hand. That slows down with age. Other people not. Right. And so, older folks are more likely to have issues with, that's reaction time, right? To be able to quickly respond to something. Eyes, ears, and other senses. And we're going to talk about, and we talked a little bit about, with aging comes something called presbyopia. And that means that you can see far away, all right, but you need reading glasses to see close up, right? So that's farsightedness coming with aging, presbyopia. Your ears. When you get older, it's easier to hear low-pitched sounds. So when you talk to older folks, if you're a girl and you have a really high-pitched voice, they're probably going to be like, huh? What? What'd you say? Right? As opposed to a lower pitch, they can hear that better. And that's part of aging. We'll talk about that. And other senses, sense of taste, right? So the gustatory sense, that's what your sense of taste is, gustatory. Taste buds, they're worn out too, right? From age. So, sometimes older folks will need a lot more salt, which leads to a whole nother set of problems, right? They got to stay away from salt, but they do because the taste buds aren't working right. And your nose, olfactory, right? Olfactory sense of smell, that diminishes also with aging. And then we have the cardiovascular system. What happens to the cardiovascular system as we age? Well, if you led a sedentary life your whole life, your heart, when you do something a little strenuous, your heart might not be able to take it. I'll give you an example. When I worked in the ER, if we got snow in the winter, we would have an unusual high amount of older gentlemen coming in with heart attacks. Why do you think that is? Anybody? Right. That's right. What happens is they don't do anything all year long. And then it snows and they're like, I'm going to go shovel. Doesn't take much. They're exerting themselves shoveling. And the next thing you know, they're lying in the snow on the ground and 911 is being called. Right. So again, that's the importance of when you're older. If you've been sedentary your whole entire life, you can't just get up and go, I'm going to go run a marathon or I'm going to go shovel the whole side. Can't do it. Right. Because your cardiovascular system is not equipped. It's just like anything else with your body. It's like an athlete. An athlete doesn't wake up being an athlete. They train, right? So if you keep your body in good shape over time, you'll be okay. But if you do nothing and you sit like you sit at a desk and that's your job your whole life, you go to move, it might not work out well. Your respiratory system, same thing. In your lungs, you have alveoli. Alveoli are the little tiny, they look like little clusters of grapes when you see them in a diagram. And they are where the exchange of gas takes place. Oxygen in, carbon dioxide out. Well, they start to wear out. So older folks, sometimes they'll do a little something and be short of breath, right? And that comes from aging. Then we have the gastrointestinal system. Few things happen here. So intrinsic factor that's made in your stomach helps you absorb vitamin B12 from the foods that you eat. Well, your stomach's getting a little older, doesn't make as much, sometimes doesn't make any intrinsic factor. So you may develop a vitamin B12 deficiency. That's called pernicious anemia. See that in a lot of older folks. Motility, peristalsis. In other words, when you listen to someone's abdomen and you're listening for bowel sounds and you hear that, right? The squeezing and letting go of the bowels slows down. Older folks will complain about constipation a lot, a lot, a lot. When I first started nursing, there was bowel obsession because for the early part of the baby boomers generation, if you didn't feel well, you didn't poop. That had to be it. Of course, that was the problem, right? And so older folks, as they got older, you're older, you're not eating as much, you're not moving as much. You're not going to have a big old bowel movement every morning, maybe. Well, they would think, oh my God, there's something wrong, and start taking laxatives and doing all kinds of things, which is not good because they wind up in the hospital with electrolyte imbalances because of that bowel obsession. What goes in, most of it has to come out. So if you're eating very little, it stands to reason your bowel movement's going to be smaller, right? Versus if you are eating a lot, okay? The urinary system. So a few things with that. With the kidneys, they slow down. The nephrons in the kidneys, the smallest functioning unit in the kidney that actually is responsible for the final filtration and creation of urine, they slow down. So they're not working up to par, which has a lot of implications. It has implications because it slows down the rate at which toxins are removed from somebody's body. And also it slows down the excretion of certain medications because medications, supplements, even holistics, herbs, all of that, when you take them, they have to get excreted either through the kidneys or the liver. The liver slows down, so it's slow to get rid of drugs, and the kidneys slow down, so they're slow to get rid of drugs. So older folks are at a higher risk for toxicity. That makes sense, right? They're going to accumulate more drug in their bloodstream because those organs can't filter it out as quick as they used to. Then the bladder. So the urge to urinate, right? So number one, older folks don't drink as much as they probably should because the sensation of being thirsty, they don't really have. It slows down. So sometimes you have to remind them, hey, did you drink water today? What have you had to drink today? And then in addition to that, when they do drink, a couple things, if they're on a diuretic, sometimes they won't drink purposefully because they don't want to run to the bathroom. Oh, no, I didn't drink anything this morning because I took my water pill and I don't want to have to try to get up and make it to the bathroom and then I'll have an accident and which is bad because if you are on a diuretic, you still have to drink a minimal amount of water, not as much as like we would have to drink, but you have to drink. You can't not drink. And then the other thing is the reflex in the bladder. So in the bladder, right by where the urethra and the bladder meet, there's a reflex there that when the bladder gets full, it sends a signal to the brain, hey, you have to pee. And then we go to the bathroom and we pee. And when we get in the bathroom, our brain sends the signal to that reflex, okay, we can pee now, right? For older folks, sometimes that doesn't work as well. And what happens is sometimes they can have either stress incontinence or urge incontinence or just generalized incontinence. What's the difference, you ask? Good question. Stress incontinence, usually women have this. And if you've had children and you haven't done your Kegel exercises, sometimes you'll cough or laugh or sneeze and a little bit of pee will come out, right? A little bit of pee, just right? So do your Kegels. That's stress incontinence, right? Urge incontinence is by the signals are slow. So by the time the signal goes to your brain and says, hey, your bladder's full, you have to pee, all of a sudden, you have to pee right now. That's urgency, right? And if they get up and try to run to the bathroom, sometimes that doesn't work out well and they wind up falling down, right? So a lot can happen because of the urinary system. So rushing to the bathroom can have implications on the musculoskeletal system because they can fall and fracture a hip. Okay. Your endocrine system, which is complicated, probably the most complicated system in the body is the endocrine system, because you have your pituitary, your hypothalamus, you have your spleen, you have your thymus, you have your pancreas, you have your ovaries or your testes, all part of the endocrine system. And all those hormones work together, right? And they all have to be just right, right? If they're not, then there are problems. So from an endocrine perspective, the pancreas, production of insulin, sometimes that gets slow. So sometimes, folks will wind up with type 2 diabetes when they're older, right? And that's usually a combination of aging, lifestyle choices like diet, lack of exercise, those kinds of things, right? But then there are other changes with the endocrine system. So for females, there's menopause, which is fun. It's just fun. It's so much fun. Menopause is when inside your body goes, you know what? We're closing shop down. We're done. We're not doing this anymore. And when that happens, it can last a while. So they'll say you are perimenopausal if you're right around and in menopause. It can last years. And the things that go along with menopause, hot flashes, fun. You literally are fine 1 minute, and the next minute it's like a thermometer. Whoosh! And you're on fire from the inside. It's like the devil got inside you and set you on fire. Right. Night sweats. Again, you'll be fine. And the next thing you know, and you're sweating like you're a construction worker that just got off the job site. Right. These are all because of the estrogen. So your ovaries make estrogen, and now your ovaries are getting old and they're going, we're not making this anymore. We're not making. So some months you'll have some and some months you won't. Some months you might get a period and some months you might not. You might not get a period for 4, 5, 6 months and then boom, you get a period. You're like, what? That's menopause. Fun. Like really so much. Now for men, they don't have all that fun, but they do have some fun. So for men, the prostate is what happens with men, and that's fun in a different way. So they don't have all those other symptoms, but when it comes to urination, the prostate will start to swell, usually benign. It's called benign prostatic hypertrophy, or BPH. When that happens, it presses on the urethra. So they go into the bathroom to try to pee, and instead of starting the stream, it goes drip, 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 drip. And they're like, come on. Nothing. And then they'll finally get it going, but they really can't get a good stream. But they feel like they emptied their bladder. They'll shake it off, put it away, drip, drip, and now their pants are wet. So that's fun too. So aging is a blast. I cannot tell you guys enough how much fun I'm having, particularly. Anyway, so and the rest of the endocrine system, things like your adrenal glands, right? Your adrenal glands are in charge of the antidiuretic hormone, right? And norepinephrine. So your adrenals are on top of your kidneys. They slow down. The production of the hormones that they make slows down. So fight or flight, right? The fight or flight response, if you're in trouble or you're scared or you're anxious about something, involuntarily, your brain goes, uh-oh, we got trouble. We're either going to have to throw down with somebody or maybe we got to run away. We got to do something to protect ourselves. So the adrenals will kick out that norepinephrine, which is like speed almost to your body. And when that happens, your body goes into a mode of like a self-defense mode, which is the same thing as test-taking anxiety, by the way, which is why when I say run like the cops are chasing you before a test, this is why it works. So the adrenals will pump out all of that norepinephrine. What happens is your heart rate will increase. The hair in the back of your neck will stand up. Your palms will get sweaty, right? You'll feel maybe even palpitations, right? And you're just like, oh, respiratory rate increases. If you have food in your digestive tract when this happens, the blood flow to your GI system will just stop. Just stop. And all the blood flow will be diverted to your legs and your arms in case you have to run or fight. And this is a primitive defense mechanism. This is why we're all still here today, right? Because this saved us when we were cave people, right? We were able to sense that there was trouble and we had to do something, right? And so it helped protect us. But now, I mean, we're not in the food chain anymore, right? There's no cougars at the bus stop waiting to attack us or eat us up, or lions or tigers or bears. So now we get anxious over things like tests or bills or whatever, right? And it's the same response because your brain can't differentiate. Your brain goes, oh my God, we're in trouble. Uh-oh. And it releases that norepinephrine. So that is the sympathetic nervous system. You can't make that stop because it's involuntary. You didn't make it start voluntarily. It just did it autonomically. So the only way for it to stop is to use the norepinephrine that's all in your blood, right? So when you fight or you run, you burn it off. And now you go into the parasympathetic. It's the letdown where everything relaxes, right? So if you don't burn it off, you've got problems. So you're walking into a test going, oh my God, oh God, what? And you can't add 2 and 2 when your brain is in that mode. It doesn't work. So that's why the running like the cops are chasing you, that works. The adrenal glands, we talked about that. We talked about the pancreas. The pancreas as an exocrine gland makes lipase and amylase. And those are 2 hormones that you need in order to metabolize starches. Amylase is for starches, lipase is for fats. That slows down. So older folks will typically have a little bit of a harder time with digestion. They'll complain about indigestion, upset stomachs, I said constipation, all those kinds of things, because everything's just slow. Your immune system. So your immune system slows down also. The way it's supposed to work is a couple ways. And there's mediated immunity and humoral immunity, and I'm not going to get into all that just yet. But if you encounter a pathogen, and a pathogen can be a bacterium, it can be a virus, it can be a fungus, right? Fungus among us. It can be a spore, it can be a mold. A pathogen is any microbe, a little itty bitty thing that if it gets into your body can make you sick. Okay? Your immune system is supposed to recognize, uh-oh, how'd he get in? And start pumping out white blood cells. So the white blood cells will go and attack whatever that pathogen is to prevent you from getting sick, right? That's the way it's supposed to work. So when people have infections, their white blood cell count goes up if they're healthy, right? Because their body's doing what it's supposed to be doing, right? It's trying to fight off that infection. When you get older, it doesn't work quite as well. So a couple things happen. Number one, it can't produce white blood cells as quickly as it could when you were younger. What you'll see when patients, older folks, get an infection, let's say they have just a little localized infection, they got a cut when they were walking on the beach, and now it's all icky looking and there's purulent exudate coming from it and it smells a little bit. So that's just a little local infection. If it's not treated appropriately, it can then become septicemia. It can become a generalized infection of the blood. Older folks do not recover well for the most part when they go septic, because what happens is their body can't produce enough white blood cells. So what it will start doing is it'll start throwing baby white blood cells into the bloodstream. It's like sending 5-year-olds to go fight a war. They can't do it, right? So you'll hear a doctor look at labs and go, uh-oh, there was a shift to the left. What that means is instead of the normal white blood cell count elevated, you'll see bands, B-A-N-D-S, bands, which are baby white blood cells, increase in numbers, but it's useless. They can't do anything. Like I said, they're just a bunch of 5-year-olds that are going to go try to fight this war, and they can't. So patients will sometimes die from septicemia, right, because of that. And then when you receive immunizations for certain diseases, polio, measles, mumps, rubella, COVID, varicella, any of those, right? The way it works is we're giving you a little bit of the virus, either alive or dead, right? And what's supposed to happen in a healthy person is that their immune system goes, oh, look, that is the antigen. That's the bad guy. So you develop antibodies. so that if you ever come in contact with that particular thing again, your body will kill it. That's immunity. And it takes a couple weeks, by the way. Doesn't happen. It's not bippity boppity boom, you're immune. It happens over time, couple weeks, usually from the time you get immunized until you start to actually develop the immunity. With older folks, there's waning immunity, right? So what that means is if you were immune before and you had the right amount of antibodies over time, and this is a new theory, the past 20 years or so, which is new in medicine, right? Of waning immunity. So you may have gotten that MMR when you were a kid, but when we check your titer, which is the level of antibodies in your blood, it's low and you need it again, right? So for older folks, this happens. Like I said, not me. I just had titers done and they're all high. But it's different for everybody because of your genetics, right? That plays huge, and you cannot change your genetics. They are what they are. I have a question? No? Oh, okay, my bad. Oh, it's the form. Okay. All right. Okay, so the immune system. So I think that's everything with your immune response. Reproductive, female and male. So we'll start with female, which we kind of already talked about, and that's menopause. Shops closed. We're done. But with it, not only those menopausal symptoms like the hot flashes and the night sweats, how about some vaginal atrophy? Yeah. So intercourse for older folks can be painful because the vagina can dry up. It's a fact. It's a medical fact. But there are things that you can do, like you can take estrogen replacement, which is HRT. They call it hormone replacement therapy. And there are topical estrogen, estradiol creams that you can put right directly in the vagina to help keep it where it's supposed to be, right? But can you get pregnant during menopause? The answer is yes. The answer is yes, because sometimes one of those ovaries has like a couple eggs left and it goes, you know what, just for fun, let's pop an egg out and see what happens. And if that's around the time you had intercourse, guess what? You're pregnant. And that's when you hear about change of life babies. If anybody's ever heard that term, oh, she had a change of life baby. They sometimes call menopause change of life. That's like a euphemistic. Americans love euphemistic language. We don't want to talk in real words. We have to pretty it up a little bit because it's hard for us to hear with our ears. But you can get pregnant. Women, I think the oldest woman to have gotten pregnant was somewhere like late 50s, early 60s. I would drive directly off of a cliff immediately, but yeah, so it's still possible. So they still need to be aware of that and use birth control because it ain't over till it's over. And it's over when you haven't had a period, usually for more than a year. And they can even run blood tests to see if you have, what the levels of estrogen, progesterone are in your blood. Question?
In menopause stage, when does the period get to stop?
Oh, so that's another thing so the question was when does menopause actually start and stop? It varies for every person. So back in the day, the average age for the onset of menses, in other words, when you got your first period, somewhere between 10 and 12. That was like the average age. Well, now we have what's called precocious puberty. If anyone's ever heard of that, and it's terrible to look at because 7-year-olds are getting their periods and they have developing breasts and they're 7, so they're babies, but they're starting to look like a teenager, which is very, very scary if you're the mother of one of them because you want to lock the kid in a closet probably. So depending on when you got your period, sometimes, not always, sometimes will dictate when it stops. But that's not always true. It's genetics. So it can be anywhere from mid to late 30s, all the way to mid to late 50s, and even as late as 60 something. It varies from woman to woman. Can't stick it in a box and call it normal. So it varies. Male reproductive system. Fun fact, males make sperm until the day they're dead. Until the day they are dead. We don't make eggs. When we are born, there's a finite number of eggs in each ovary. That's what we got. That's all we've got. And that's it. That's the end, right? So we don't make eggs. The eggs are there, but then they mature when we hit puberty. And then once your period starts, every month they alternate. Like the left ovary this month pops out an egg, boom. The right ovary the next month pops out an egg, boom, right? And on and on and on. Men make sperm with an axe lodged in their skull. That was funny. They can make sperm. A man can have a baby. A man can impregnate a woman basically until the day he's dead. Right? So look at the looks. If only you could see the looks I'm getting, but it's true. And because they're constantly making sperm. So if they're having sex and the woman is of childbearing age, they can have a baby when they're 80. Yep. Robert De Niro just had a baby. He's like 82 years old. You know, I don't know if he's going to live to see the kid graduate high school, but at any rate, he just had a baby. Anyway, so there we went through the specifics, right? Each of the body systems and what can happen with the aging process. All right, moving on. Geriatric care settings. Ugh. Right. In other words, nursing homes, long-term care facilities. Okay. Assisted living facilities. Okay. So basically, you know, if somebody is older and they have a chronic illness and they don't have family, or they do have family, but their family's not very nice, and they're like, we don't have time to take care of you, Mom. They put you someplace. So where you go, whether it's assisted living versus long-term care, depends on a lot of factors. Number one, do you have money? If you have money, you can go to assisted living because, fun fact, Medicare does not pay for assisted living. There is no Medicare reimbursement for assisted living. They will partially pay for long-term care, but only for a minute. And then you have to sell everything you own right away and use up all the money, and then you can get Medicaid. Yeah. And that's the way we run it in this country. Isn't that fun? So I'll say it one more time. So when you get older, if you need care that your family can't provide, if you have money, then you can go into an assisted living facility, but that you have to pay. And does anybody know how much it costs to live in an ALF every month?
Like between 7 to 10,000 or more.
Depending on your geography. If you live in Miami or the Lauderdale area in Florida, you're gonna pay 12 grand a month. If you live in North Jersey, closer to New York, you're going to pay about 7, maybe 8, sometimes even 10 grand a month. Down here, assisted living facilities can run you like 3,800, 4 grand, up to like, I've seen them as high as 6,500 a month. So the months come by quick. Imagine if your rent was 10 grand a month, because that's basically what it is, right? So if you have money, right? But if you don't have money, now you have a problem. Okay. Yes, I'm going there next, to the nursing home. So, and the reason that there's a difference in price in a nursing home, in long-term care, the assumption is that you need a nurse 24 hours a day. You need skilled nursing 24 hours a day. Okay. Assisted living, the name implies assisted. You're all right, but you need maybe a little help, like with your meds, maybe a little bit of help with ambulation, right? Or meals. So they cook meals. So you just go to the dining room and you get served your breakfast, lunch, and dinner and stuff like that. But a nursing home, long-term care facility, can run you anywhere from $9,000 a month up to $15,000, $16,000 a month because of the beautiful, beautiful accommodations that are in nursing homes. That's a joke. Okay. They are not beautiful accommodations. So nursing homes will get people that require more care. So if you go into the hospital and you have cardiac problems and you've had heart failure exacerbations multiple times and you've been in and out of the hospital and and you can't care for yourself and you need nursing, so you go into a nursing home. So initially what they'll do is they'll put you in under subacute, right? Because subacute, Medicare will pay for that because that's considered rehab. So they'll put you in And then there'll be a time frame on that because then you have to participate in physical therapy and occupational therapy and sometimes speech therapy to get better. But sometimes you don't get better. So then what? So then they say, well, your time is up. What are you going to do? And they can't go home because they can't get up the stairs. They can't get to the store. They can't live alone. What do? Well, sell your house and sell everything you own that you worked for your whole life. Sell it, pay us. And then when the money's gone, we'll help you get Medicaid. A round of applause for the healthcare system in this country. No, isn't it great? No, no, no. And also another fun fact, Medicare does not pay for dentures or hearing aids. And what are the two things that old people need? Dentures and hearing aids. And it does not pay. We pay athletes millions of dollars to play a game on TV, but we can't take care of our old people. Yes. Yeah. And we just have a skewed sense of what's important. I think that my own personal opinion does not reflect the opinion of AHE schools nor any of its affiliates. There's my disclaimer. Okay. So that is, in essence, that is a good summary of assisted living, long-term care, subacute, right? So that's all that. And next here, sometimes you can get home care. So Medicare will pay for intermittent home care. So in other words, Medicare will pay if you're sick and you just got out of the hospital or you just got out of rehab and you do go home because maybe your family's like, we'll help. So you go home, they will send a nurse, physical therapist, occupational therapist, aide for a little bit, intermittently, not to stay, but like the nurse will come in, say 2 or 3 times a week, maybe help with the meds, fill your pill box, whatever, stuff like that. But for a finite period of time, right? And with Medicare certified home care, usually it's 3 months, 90 days, and they're like, you're better now. We're done. If you want someone to come in and stay, well, then I hope you have money because then you're going to have to pay out of pocket because Medicare does not pay. Like if, let's say you need a home health aide, right, to come in like during the day and help you with meals and stuff like that, which is a wonderful thing. You can even get them live-ins that will come in and live in your house if you can afford it, right? Because a live-in's about 100, 120 a day, right, give or take. And it varies for costs for private duty aides, like how long you need them. It's usually by the hour. So again, if you have money, you're all right. If you don't, oh, it's too bad. So sad. We're sorry. Right. So either your family has to help, and if they can't or won't, what happens, right? All right. And we went over this. There is also something called independent living. So these are usually apartments or condo-like joints that'll be, the rent will depend on your income. So if you're on a fixed income with Social Security or whatever, the rent, it's almost like a Section 8 for old people, right? But you have to be some are over 55, some are over 65. Some have waiting lists because there aren't a lot of these that are as long as a mile, to get into them. And what they do is they'll come check on you. They're not providing care because it's independent living. So it's not like there's a nurse to come in and, but if something should happen, there's call bells in there. So let's say you fall and you can't get up. You can hit the call bell and someone will come help you quickly. You know what I mean? So that's independent living. So that's one other thing. And then senior centers. I mean, it's where old people go to die. No, I'm kidding. It's where they go to play bingo. Right. And have a little socialization. Right. So if you ever see me in one, I want you to kill me immediately. Okay, please. All right. Let's move on to the next slide. Question. Long-term care facilities have all the required on-site services similar to an acute care facility. An acute care facility is a hospital. Does a long-term care facility have everything a hospital has? No, it does not, right? It does not, right? So they can draw your blood. They'll usually bring labs in to draw your blood, stuff like that. but they don't have X-ray machines and MRI machines and that kind of stuff. So it's not the same. They'll usually transport you to a hospital if something happens. Okay. What kind of help do old folks need? So sometimes physical help, sometimes financial help, sometimes emotional, sometimes social, different for every person, right? So nutrition, we'll talk about nutrition quickly. So is this person able to get to the grocery store, get their food, bring it home, unpack it, cook it? You know what I mean? All the things that we need to do to be able to get good nutrition. You know, that's a concern. And as they get older, nutritional needs change. And sometimes tastes change too, like we talked about earlier, where they might not like the same things. Do they have the energy level to do all that? You know, I don't like going to Walmart. Okay. Walmart, it just drains the life out of me when I do a Walmart trip. I can feel it. Um, and then cultural preferences. Are there foods available for what they like, or maybe what their religion dictates they can or can't eat? There's so many implications, right? And then the effects of medication. Some medications make you hungry. Some medications make you not hungry, right? Some medications give you a metallic taste in your mouth, and then nothing tastes good, right? And then do you have any symptoms like CHF? I always go back to that. Are you eating too much salt? Are you eating frozen dinners? If you look at frozen dinners, pick any frozen dinner, even one that says low sodium, and look at the label and look and see how much sodium is in there. Okay. If you're supposed to have 1,500 milligrams a day, all 1,500's in that one meal. So don't eat anything else for the rest of the day. And then financial concerns. I had a woman come into the ER who was eating cat food because she could not, and this happens a lot, cannot afford her food, just broke as a joke. And cat food, by the way, canned cat food has a lot of protein in it, right? Because cats are primarily carnivores. So there's too much protein in cat food for a human. So what do you think happened to her kidneys? So that'll put you right into kidney failure, eating all that protein. Your kidneys can't process all that protein. So we got a problem in this country, little problem. This is the thing. If some people just don't know it's available, or and the amount of help that you get, by the way, nobody's giving you money. Nobody's giving you food. You may get food stamps, but it's not a lot. So I laugh when people say they like living off the system. Nobody does. Nobody does. I was on the system. The system's terrible. It's terrible. You know, they give you, for a family of four, if you get $300, that is gone in a week. And then what? You see what I'm saying? Same thing with older folks, you know. Now, the state of New Jersey has something called the PAAD program. It's a pharmaceutical assistance to the aged and disabled is what that is. So we pay state income tax, and I'm happy to pay state income tax because some of it goes to a good cause. PAAD, if you meet a certain income criteria, if you're a senior citizen and your income falls below a certain level, then they will pay for your medicine, which is a good thing. That's a good thing. But like states that don't have income tax, they got no help in Florida. Nothing. There's nothing. There's no social support network in Florida. The states that people are like, there's no income tax. It's not as good as you think it is when you think about it and all the ramifications, right? So anyway, so moving on. Do they have teeth? A big problem with older folks sometimes. They don't have any teeth. And although some people, and we talked about this before, can gum a steak, I don't know how they do it. They do it. Most people can't, right? And if you had dentures when you were, say, in your 60s, and now you're in your 80s, your face will change, right? So you may lose weight, whatever. The dentures don't fit. So they'll have, yeah, do you have dentures? Uh-huh. How come they're not in your mouth? Well, they don't fit. Have you thought about getting new ones or can't afford it? Swallowing difficulties, if they've had a stroke, if they've had a TIA is a transient ischemic attack. It's a mini stroke, right? Sometimes they'll have difficulty swallowing. Sometimes they're on so many medications, I mean, so many, polypharmacy, it's called, that It's a job to just take their meds every day. Right. And they take so many pills. Sometimes they're like, I'm just full from all the pills. I don't want to eat anything. Right. And I talked about them not drinking enough water because they're not thirsty. Decreased sense of thirst, dry oral mucosa, total body fluid volume or percentage of fluid in your body will diminish because you're not, when people retire and sit in a chair and watch TV all day, no good comes from that. They're isolated and we are social creatures. We're not meant to be completely alone and isolated. If they put a person in isolation in prison, they'll go nuts, right? Because we're not meant to be like that. We're cave people, right? We want to be with our tribe. That's just the way it is. And so isolation, they don't move, they sit and watch TV. They don't wind up doing well. They wind up dying younger, right? Decreased circulation. I already talked about all of these things, right? Functioning of older folks don't spike temperatures, fevers, the way younger folks do. So you may have an infection and you may not have a fever. Matter of fact, we may take your temp and it might be 97.9. And we're like, wow, that's low because circulation metabolic rate is slowed down. That's why they're always cold. Cold, cold, it's cold. I'm cold, right? Confusion and forgetfulness is not an expected part of the aging process. It does not have to happen. Okay. It does not have to happen. Personal hygiene. Are they able to bathe themselves, take care of their oral hygiene, take care of their hair, their nails? Can they shave? Can they get dressed and all those things? Question? That happens to me once. That happened to me when I was 30. No, 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 no. That's just, if you have a lot on your mind, you might forget something, right? So that's not, so forgetfulness and confusion is not a normal part of the aging process. There's no, edict that says, you hit 65, you're done. You're going to get confused and start forgetting stuff. Anybody can become forgetful, right? And young people are forgetful too, right? And the thing is, if you want to keep your brain sharp, you have to use it. So it's just like anything else. If you want to keep your muscles big, you have to use them. You can't just sit. If you want your brain to be sharp, you have to use it. You have to use it. So sometimes, like I said, people retire and they do nothing. Nothing. What do you think's going to happen? Right? What's going to happen? Your brain's going to turn to mush, right? You have to keep moving. Constipation, incontinence, difficulty voiding. I covered all that already with the body systems. Question, is the following statement true or false? Impaction. Does everybody know what impaction is? Fecal impaction. So that is when sometimes old folks don't get the urge to go to the bathroom. And whatever stool is in the rectum, which is right above the anus, your anus, it'll get hard from sitting there, right? Because that's the final step before it comes out. So there's not a lot of fluid there. It's not going to keep it moist. So it's going to get hard. Then the next thing you know, it's been a day. It's been 2 days. It's been 3 days. It's been 4 days. I've seen people 7 days, no bowel movement. What did they do anything for you when you were in the hospital? No. Okay. So sometimes we have to disimpact them, which is fun, right? And it's also dangerous because you have a nerve in your body called the vagus nerve, right? It's one of your cranial nerves, and it's the biggest nerve in the body. And it runs from your central nervous system, from your brain, all the way down to your anus. The vagus nerve, not like Las Vegas, right? VAGUS, vagus nerve. That ends in your rectum, your anus. If you go in with a finger to digitally disimpact an older person, if they have any cardiac issues, oh, you better not do it, right? Because you can stimulate the vagus nerve in their rectum and anus and make their blood pressure and heart rate plummet. So you're always going to put them on their left side. If they don't have any major cardiac issues and you can see that they're impacted and get it out, put them on their left side because that eliminates pressure on the descending aorta and the vena cava. So the best way to lie, also when you're pregnant, is left lateral, always left lateral. Lie on your left side. Takes pressure off those big blood vessels, right? Helps keep the blood circulating. So,
or when constantly feel like when you pushing the
Valsalva maneuver. So if an older person is sitting on the toilet trying to have a bowel movement and they bear down real hard, that also can contract that vagus nerve in the rectum. And guess what? People drop dead on the toilet all the time. All the time. All the time. My ex-father-in-law dropped dead on the toilet, heart attack. So that's why they shouldn't be straining, right? So that is called a Valsalva maneuver. And that comes in handy for some things. I don't want to get into all of that, but it's very dangerous for other things. So if an older person is sitting on the toilet for a while and they're trying to have a bowel movement and it's really hard and they can't get it, at some point, if they have an underlying cardiac issue, their blood pressure and heart rate will drop to the point where they may have an MI and just bloop. He was doing what he loved. Anyway, so impaction is a serious issue, right? Because if we don't do anything about it and they don't move their bowels, and we're talking 6 days, 7 days, 8, whatever period of time, what can happen is that's the same as having a bowel obstruction and your bowel can burst. Boom. And you're sure to pass with that. Even if we get you to the hospital, you're going to be septic in a matter of minutes. What's that? I mean, you wouldn't see it because it's internal, right? It's all, well, it's more about what's in the bowel is poison, it's toxin, it's poop. So if your large bowel ruptures, all of that poop, toxin, everything that's in there is now just in your peritoneal cavity, right? So it's not the bleeding that's going to kill you. It's the septicemia that's going to kill you. You're going to go septic quick, quick, quick. Okay. Mental health, anxiety. Again, when folks get older, depending on where they are, right, in their lifespan, they can start to become anxious, right? Baby boomers, we're not allowed to be anxious. Our parents would go, shut up, you're fine. And we'd be like, you're right, I'm fine. What's for dinner? Dinner. That's how we were raised, you know? You could beat your kid up in the grocery store and people would join in. They'd be like, oh, she must have done something really bad. Let's hit her. I mean, that's the way it was when I was a child. That's just the way the nuns hit us in school. They were allowed. That was a real thing. They would beat the crap out of people for real. I went to Catholic school. That was part of the reason I started keeping my hair short because they would pull your hair. They'd pull hair out. Anyway, anxiety. So we're not allowed to be anxious. We're not allowed, you know, we just have to be like, we're stoic. We're good. Nothing wrong with us. But sometimes you do get anxious. So what do you do to manage it? Because you can't eliminate stress, whether you're old or young. So you have to manage it somehow. How do you get through the day, right? So with older folks, money is typically an issue because they're on a fixed income. Maybe they can't get a job because they're older, right? I'll be honest, when I sent out resumes recently, I didn't put what year I graduated college because they needed to see me before they made a judgment call, because that's ageism. A lot of times you won't even get an interview because if they say, oh, she graduated in 1994, geez, how old is this woman? Right? And when they picture somebody 62, they're not expecting this, you know? So, but that's ageism still, because I have a lot to offer based on my experience and my knowledge and the things that I've done, right? And I will always work. Maybe I won't work as much, but I'll always work because it keeps your mind and your body sharp, right? So ageism is when we make these judgment calls about folks just based on their age. You know, oh, she's too old or he's too old. Oh my God, how old is that one? No, no. So that's not right. So that can result in depression for a lot of people. I'm going to get to Erickson. Erickson, did anybody ever talk to you about Erickson and Maslow? So Erickson went through stages of growth and development in human beings. And for people my age, the stage is called integrity versus despair. Right. And it's a very important stage in your life. And I'm going to get to that. Okay. Depression can happen for all these reasons. No exercise, you're isolated, you're broke, you don't have any friends, your kids don't call, your grandkids never come around. Medications, they drugs, alcohol, plethora of reasons why older folks can get depressed. Sometimes you'll see older folks have problems with medications, legal or illegal, for the same set of reasons. I'm depressed, so the heck with it. You know what I mean? So that happens a lot. So integrity versus despair. What does that mean? If you get to this age, and this age, I mean, I believe that the age was supposed to be like 60 and up, right? Either you have had a life with a lot, and I've had a life and stuff, right? And I've made mistakes, but I don't have any regrets, right? Why? Because even when I screwed up, it taught me something. Just don't do it again. Like, don't be silly. If you make a mistake, learn from it, right? So despair, that's those people that are bitter and resentful and angry, and they have a chip on their shoulder. Oh, I got a life full of regrets. My life is terrible. So if you're in that despair state at this age, you're not going to do well. You're not going to do well because you're going to be depressed and angry and resentful and bitter and all those things, right? So Erickson made a very valid point. Integrity means, yeah, I had a life. It was good, it was bad. That's life. There's some good, there's some bad. I learned from the bad. I don't have any regrets. That's the way it went. I'm cool with it, right? If you're there, you should be all right. Hopefully, we'll keep our fingers crossed that I'm all right. Come see me in 20 years. We'll see how I'm doing. Polypharmacy, I talked about that already. Lack of purpose. Why do you get up in the morning? Right? Why do you get up? This is a question that I would ask older folks when I looked at them and I saw they seemed depressed. Because if you come out and ask someone, hey, are you depressed? You're not really often going to get an honest answer, right? So my question would be, hey, why do you get up in the morning? What makes you get up in the morning? What do you do? That, they'll stop and think about it, right? Some people will say for my kids or for my grandkids. Some people will say for my job. But what if you don't have kids or grandkids, and what if you're not working? Why do you get up in the morning? It's an interesting question, isn't it? Right? How do you do it? Why do you do it? Yeah, I guess I'll do it again. I'll get up today. There's got to be a motivation for people. People need a motivation. They need a reason to do things. And if people feel they have no reason to do things, that can be a real significant form of depression that can sink in and really can have some ill effects, right? And then as far as abuse, elderly folks that are abused are typically abused by their family. That's another fun fact. Not strangers. Their loved ones are the ones that abuse them. And I think this talks about abuse. I think so, but we'll get to that in a minute. So what do you do to motivate older folks? So reminiscence therapy really works, especially with dementia patients. Tell me about when you first went to college. What was it like back in the day? What did you do for fun when you were 17 or 8? That's reminiscing. And it's a good time, for most of them, as long as you talk about something that was a positive thing, right? Things that stimulate their brain too. Bingo, I mean, they say it's stimulating, but Sudoku, crossword puzzles. Back when there were newspapers, I used to do the New York Times crossword puzzle. We're talking a while back, but that keeps you got to think, right? It's good for you. Animals. There are studies that go both ways. There are studies that say for older folks, having a pet of some sort, and not a goldfish, because you can't pet a goldfish, like a dog or a cat, is helpful, right? Because it helps you with purpose. And also it's companionship. Even if they don't talk back. I mean, I talk to my dogs. I know they're not going to answer me. When they start answering me, then there's a problem, right? But they're company, right? I dig that. And also they're big dogs, so they're protective. So that's cool. So, but some studies say having pets and having all that responsibility, like I got to get them to the vet and they have to get their heartworm medicine and that can be a downside of it. My opinion is pets are good for people. You know what I mean? So that no grown woman wants to play with a baby doll. Let me explain that. Because what happens is when they have severe dementia, they're not living in the present, right? There's no present. They're living when their kids were babies, right? In the past. So you give them a baby doll and in their mind, it's like a baby, right? And then I see old folks in nursing homes with like little, like, yeah, like that out of her hair. Where is the dignity? That is not, if anybody did that to my hair, there would be consequences. You understand? I'm not 5. These are human beings that are adults, that raised families, that went to work, they had jobs, they had homes, they had lives. And now you got her looking like this. Stop. They don't like it unless they're really confused. And if they're really confused, it's your responsibility to maintain their dignity because they can't maintain it themselves. So when you do that, it's very demeaning. Right. Also, when you go, how you doing, honey? Are you having a good Jesus? Right. You can just talk to them the way you talk to them. Hi, how you doing? You having a good day? What's going on? You don't have to talk to them like they're a little baby. That's demeaning. It is demeaning. Treat them with respect, just like you would any other person. Right. And if they're confused and agitated, which would be me if I were confused, I would be the most combative, agitated woman you'd ever meet. Diversion. Don't try to argue with somebody with dementia. You will not win, right? Because whatever they have, I'm going to the bank. I'm going to the bank. I got to go to the bank. It's time to go to the bank. Let me out of here. I'm going to the bank. I'm going to the bank, right? You can't say to them, well, no, you don't need to go to the bank. What you say to them is, yep, we're going to go to the bank. But first, we have to go see so-and-so in this room, or we have to go fold these clothes out of the dryer. Anything. Diversion, and then you won't have an argument. Or play some music from their from their era, you know what I mean? Depending on their age. Little Elvis, little Frank Sinatra, Tony Bennett, something like that. Music speaks to people in ways that words can't, right? And it'll bring back memories of hopefully happy times when they were younger. It works, right? If they're religious, that stuff too, all that goes along with that. They're priests or yeah, they will always remember the past. It's short-term memory with all dementia. Short-term memory goes. Long-term memory will stay. So they can tell you what they did in 1956. But who are you? Again, they're meeting you every 5 minutes for the first time. You know what I'm saying? So reminiscence therapy really is nice if you can say to them, how'd you meet your husband? They say, I got to go see my husband. I got to go see him. He's waiting for me. He's waiting for me. And he's dead. You don't tell that woman, your husband's dead. He's been dead for 10 years because then she's going to relive that all over again. What you say to her is, how'd you meet him? How'd you meet him? How old were you when you met him? What happened? Tell me about it. And those are happy thoughts and it's diversion. Right? Gets them away from, I got to get out of this place. Because the underlying motivation is, I got to get out of this place. Right? I don't blame them. Want to get out of the place too. Okay. Communication. There's our presbyopia, which I talked about, the need for reading glasses. I'm going to highlight this. Right? And this is a fun word that even I have difficulty sometimes. Sjogren's syndrome. So the S and the J become SH. Sjogren's syndrome. And we'll talk about that. It is just poor circulation, right? And it's almost like Raynaud's. And we'll talk more about that in a second. I'm going to go back to that. Hearing loss. Presbycusis. That's the difficulty in hearing the high-pitched sounds, right? Yeah. So when they're older, they can hear the low-pitched sounds, but they can't hear the high-pitched sounds. So if you're trying to talk to somebody and they keep going, huh? What? What'd you say? Excuse me? So maybe just try to get your voice a little bit lower and look at somebody when you're speaking to them and slow down. And if they still don't get it, rephrase what you're asking. And that applies for hearing impaired people in general. If you say, did you eat? Did you eat? Do you want to eat? Do you want to eat? Do you want? And they're going, what? Rephrase it. Say, are you hungry? Say it a different way. And sometimes they'll better understand you that way. Right? So let me highlight that. And so the PowerPoint says speech impairment, aphasia. Aphasia means without speech. It is not a normal part of aging to not be able to speak. So I am going to leave this. Well, no, here's what I'm going to do with this. Watch. Now it's gone. Bye-bye. See you. There's no aging process that involves losing the ability to speak. Now, if they have a cognition issue, that's different. And in other words, if they do have dementia, any form of dementia, then they may not be able to remember words. If they've had a stroke, oftentimes they'll have expressive aphasia, which means they know what they want to say, but they just can't make the words come out. So then you can use like picture boards, communication boards and stuff like that to communicate with them. But there is no aging process that would cause a person to lose the ability to speak. It would have had to have been a traumatic brain injury or a stroke or dementia or something that affects their brain capacity. So that's that. All right. Proprioception. This is a fun one. Proprioception means understanding where you are in relationship to other things. Here's an example. I'm standing right here and the TV is to my left and it's about 1.5 feet away from me. So in my mind, I know that if I want to move and there's a cord here, what am I going to do to get out of here? I'm probably going to go this way, go around it. When you're driving, how much room do you have to get into that parking space, right? So proprioception is understanding where you are in relationship to the things and people around you. When you get older, sometimes that diminishes a bit, right? So balance is affected, right? So if I say, oh, I'm going to go this way, even if I move this, but I can't lift my leg to get over that, but maybe I think I can, what's going to happen? I'm going to fall. Right. So that becomes sometimes a problem with aging. That's a real thing, right? If they're looking up, sometimes they'll get a little vertigo, a little dizzy, right? And then try to walk and like, whoa, fall down. When they change positions, orthostatic hypotension, sometimes because of medications, sometimes because of bad circulation, they're lying in bed and they try to jump up out of bed to go to the bathroom. They may fall down because their blood pressure drops and orthostasis happens systolically, a drop of 20 millimeters of mercury, diastolically, a drop of 10 millimeters of mercury. That qualifies 20 millimeters systolic. So drop 20 millimeters systolic, drop 10 millimeters diastolic, and that is considered orthostatic hypotension. It's enough to make somebody go, ooh, and fall down.
Most of the times when you get out of bed, right? Like
It can happen anytime. It can happen if you're sitting and you go from sitting to standing. So like I said, the real distinction is if it's that much of a drop. If your blood pressure sitting is 140 over 80, and then when you stand up, it's 120 over 70, that's a big drop. That's enough to cause dizziness. Everybody's blood pressure changes when you move. That's normal. It has to. But it shouldn't drop that much. When it drops 20 systolic, 10 diastolic, you're going to be symptomatic. You're going to get dizzy, lightheaded, and possibly fall down. So it can happen with any positional change. Lying to sitting, lying to standing, sitting to stand, any positional change. And of course, if you're helping somebody walk, you don't want to grab their arms. You could actually dislocate a shoulder. The best way is if you get them under the arm, right? Or a hand around the waist or a gait belt if they're really having difficulty walking, okay? Safety devices, walkers, canes, quad canes, right? rolling walkers. There are lots of assistive devices that help people walk. Some people furniture surf in their house. And what that means is when they get up, they can't just go from sitting to standing. They're going to hold on to furniture, walls, windowsill, whatever they can hang on to. That means they need an assistive device. If they need the wall to get up, they should probably have a walker or something, you know. Restraints. Client safety devices. Oh, no, they are. So they are not client safety devices. In as much as if you have a confused patient that's in ICU and they're intubated and they have a PICC line or a TLC line and they're trying to pull stuff out, then yes, what you're doing is you may have to restrain them for their own protection, right? Yeah, and restraints need a doctor's order, and a restraint order is only good for 24 hours. And you have to fully document that you did everything else that you could have done. This is the last resort, restraints. And you have to check the restraints, neurovascular checks, like if they have a wrist restraint on, never tie it to a movable part of the bed, ever, ever. Because what can happen if the frame, so you put it on the side rail, the frame moves, guess what? They could hurt themselves. And always check neurovascular checks every 15 minutes. You heard me. Every 15 minutes. Sometimes restraints are more of a pain in the neck than they are worth. Because if you can get a one-on-one with that patient and you're able to keep them, calm with a one-on-one, do that instead. And every 2 hours, the restraints have to be fully released. So if they have wrist restraints, what you do is you would unrestrain one wrist just to be safe, right? Every 2 hours. First, unrestrain the one, let them whatever, and then put them back in that restraint, then unrestrain the other. Makes sense? Because you wouldn't want to unrestrain both of them because something bad might happen if they have both their arms, especially if they're big and they're combative. I mean, there are lots of reasons for restraints. Restraints protect them from themselves or protect other people from them, right? You may have, in psych units, you may have somebody who's agitated, combative, angry. Even not so much a trach, but intubated, right? When we put an endotracheal tube down your throat and we got a tape here, your first response is to pull it out. Anybody would. When you open your eyes, and they want to pull it out. Well, if they pull it out, they're not going to be able to breathe, right? So we can't let that happen. Usually we'll use conscious sedation to keep them sedated, like Verse said, because, that if they need a ventilator and an intubation to breathe, they're going to try to pull it out. It's just human nature. If you feel something like that, you want to get it off. So that's, in that case, it is for their safety that, you would restrain them. And again, if a restraint is not used properly, people can get hurt or even die, right? So that's got to be kept in mind. Physical activity, you got to sweat. Got to sweat. Everybody's got to sweat. Even just a little bit. But if you sweat 3 or 4 times a week, it's better than nothing, right? You have to get physical activity that raises your heart rate, right? You can't just sit. If you sit 7 days a week, it's going to be bad when you get older. When you're young, your body's compensatory. Your body will compensate for all kinds of bad behavior. You know what I'm saying? When we're young, we do all sorts of stuff, right? And we may feel a little crappy for a minute, but, we'll bounce back. But when you get older, you don't bounce back like that. That rubber ball theory, gone. Like if you get drunk when you're my age, I got news for you. You need 2 days, right? You need 2 days. Where when I was 19, I'd be like, yep, I'm going to work in the morning. Woohoo! But the older you get, again, the alcohol gets out of your system slower, right? And you're going to feel the effect of the alcohol more quickly than, somebody younger might. So that's dangerous. So back to exercise. So what can happen if you don't get exercise when you're older? Kyphosis. You ever see the old ladies like this? Oh my God, stand up. Luda said it, stand up. Osteoporosis, pathological fractures. All you have to do is make a move, break a bone, right? You don't want that. Contractures. Anybody ever seen a patient with a contracture? So a contracture is where a limb, leg, or an arm is like this, and you can't undo it. That should never happen. That's a disgrace, because if somebody can't move, you're supposed to be doing passive range of motion on that patient. In other words, you move their arms for them so that they don't lock up like that. Because once they're locked, you ain't unlocking them. And think about what happens if my hand is like this, contracted, right? First of all, you'll see they'll put washcloths in here, because what'll happen is they'll dig into their own palm. And then here, if this is contracted like this is going to get a fungus infection in here in the fold. That's not even about, just, yeah, moist and dark. That's what fungi love, a moist, dark environment, right? So many consequences. So prevent it. Pressure wounds. If they can't move, you're supposed to move them every 2 hours, minimally, right? Constipation. You're not moving, you're not drinking water, you're going to get constipated, right? Renal and pulmonary complications, cardiovascular disorders, depression, social isolation, all the things that I have talked about. Sexuality. Individuals generally maintain ability and desire to engage in sexual activity as they get older. There is a town in Florida called The Villages. Google it, okay? It's the biggest retirement community, I think, in the world. It's its own town. It's called The Villages. It's in Central Florida. I've been there. I've taken care of patients there. They have the highest rate of sexually transmitted diseases in the whole state. Google it. The Villages, Florida. Okay. So yes, people are still, doing the nasty. If they can do it, they're doing it. They may not be able to be in the shower and do all kinds of crazy, reverse cowgirl or anything like that. But they can still do it. Man, oh, my back, I threw my back out. Wait a minute, I can't do that right. And it's healthy. It's healthy. We're made to have sex. It's healthy. That's right. And also not just sexual activity, but just touch. I'm Italian, so we're very touchy people, right? I hug my grandkids all the time. I hug my kids. I hug strangers. I hug my patients. I mean, it's like people need to feel a little something like you care about them. It's easy to do. It really works, and we need that physical touch, right? Everybody needs to know, just sometimes if you're talking to somebody and you know that they're not, they're sad, you don't even have to say anything. You can just put a hand on their shoulder, I hear you. I hear you. And just be there for them. So touch is very important for everybody, old and young. Elder abuse. Here we go. Lots of forms of abuse. Abuse can be neglect. I leave you lying there in your urine 12 hours. Abuse can be abuse, like physical, like hitting someone. Abuse can be verbal and emotional. You're a moron. You're an idiot. You don't deserve to be here. What good are you? Right? Those types of things. Financial abuse. They don't know what's going on. I'm going to take their checkbook and go on a shopping spree. Right? So abuse takes many forms. The elderly are the highest in vulnerability as far as risk for any type of abuse. And oftentimes they'll be afraid to talk about it because it's probably the person that's their caregiver, right? But if they say something, they're going to throw me in a nursing home. So that's it's a very bad situation. As nurses, we are legally, ethically, and morally required to report it. End of story. You must report it, right? Typically, if you're taking care of a patient, you suspect that there's something going on, you report it to your supervisor. They must follow up. Home care, we would call adult protective services, which I had a patient in Florida, and his wife was extremely demented. He, at first glance, appeared to be oriented, but you got to talk to people to really know if they're confused or not, because some people can hide it well. So he would have the newspaper sitting on the table. So when I would come in, I'd say, oh, how about that stuff? And he'd start talking about current events. And he seemed like, like he was together. Well, I went there one day and I walked in and went, what is that smell? He had put 3 bottles of ketchup in the oven and was cooking them, the plastic kind. I was like, oh, then I started asking him specific open-ended questions, no newspaper next to him to help him out as far as dates and stuff like that. He didn't know what day was up, or he knew nothing. He was confused, but he knew he was confused. So he's at that stage. There's a stage of confusion for some people where they know they're getting confused, but it comes intermittently. They'll have periods of being lucid and they'll be like, oh my God, I can't. If somebody finds out, they're going to take my wife away. They're going to take me away. Right? So they get scared. So they try to figure out ways to compensate to cover it up. He was good at it too. It was a sin, but he was going to burn down the house and kill them both. You know what I mean? So APS was called and they said that he was okay. Yeah. But then I had called the family and the daughter and it was the son and daughter-in-law stepped up and brought them to live with them, thankfully. But you have to report it anyway. And if you have to report it again, you report it again. You do whatever you have to do to make sure that they don't die in a fire, because that's a terrible way to die. Okay. Okay. And then caregiver stress. If you're the sole caregiver for your 88-year-old demented bedbound mom, you're going to get stressed out. It's only a matter of time. You're human. Anybody would. Right. And so sometimes it's not like they're a mean person, just like, oh my God, I can't change her again. This is day and night. It can be very stressful. So there are some community resources available for things like respite. Respite is, we're going to give you like a 5-day break, right? We'll put her in a nursing home. Not the best alternative, but it's better. At least the caregiver doesn't have a stroke, caring for mom. So there are some things that can be done to help.
Also,
Right. It's only temporary. It usually could be 5 days, 7 days, 10 days, so to help them so that the caregiver can have some sort of a break from that strain of caring for that person. Some signs of abuse that you don't want to ignore. Either they're always at the doctor or they're never at the doctor, right? If they're never at the doctor, never, ever, ever, like not even for like their immunizations, routine checkups, you have to wonder why. Right. And if they're always at the doctor, are they a hypochondriac, which could be, or is it because there's stuff going on and they're scared that maybe there's underlying damage, right? Unexplained injuries and injuries at different levels of healing. That is a telltale sign. So, and if someone has bruises on the upper arms, like here, just picture it. Stop it. Right? And if someone has bruises in areas, like I said before, I worked in an ER. When toddlers came in and they had scraped up knees, you get that. Toddlers, they're just learning how to walk. They fall down, their knees get scraped up. They don't have bruises anywhere else. Their knees are just all banged up. But if somebody comes in and they have bruises on their face, on their neck, on their back, on their legs, in different stages of healing, something's up. Somebody's hurting that person, right? So now we need to find out what's going on. Malnutrition, unexplained weight loss. That could be neglect. I can't feed you anymore. I'm done. I guess you just don't eat. Depression, older folks, if they're being cared for by somebody and there's suddenly a change in their disposition or their mood, something is probably going on. Here's just an extra note. Sometimes older folks will commit suicide because sometimes there's that feeling of helplessness and hopelessness that gets so bad that they don't see a way out. And I had a patient who shot his wife in the mouth. And instead of shooting himself in the mouth, he tried to shoot himself in the head, messed it up, but he died. But they both died. Anyway, she was going to have an amputation. This is a true story. This was in Ormond Beach, Florida in 2005. Okay. She was going to get an amputation. She had peripheral vascular disease and probably was going to wind up having the other leg amputated at some point too. She was so depressed, and they were from Philly. So I wound up getting on the phone talking to the daughter in Philly, and she was going to come visit. She came to visit, and that night he shot the wife and killed himself. Killed her, killed him. I got a phone call from the daughter from the emergency room at Ormond, Florida Hospital, Ormond, because he felt like there was no good thing was coming after this. We are old. They're chopping off her legs. She's depressed. I'm depressed. We have nothing to live for. The hell with it. So you always want to ask people, if you see somebody giving away things that you know are precious to them, that is a sign. That is a sign that that there's something funny, right? So like I have books, I have antique books that I love. If I start giving them away, something's up, right? So everybody has like their thing, there's something that they love. You know what I mean? They start giving that stuff away, or if they start making comments like, oh, that's a good one. Sometimes they'll be real depressed, and then all of a sudden they'll say, you know what? I'm good. I feel good. Why? Well, now they have a plan, and you need to ask them, do you have a plan to commit suicide? And they'll usually tell you. Sometimes they won't, and sometimes they just commit suicide. And because if somebody has suicidal ideation, the thought of committing suicide, I mean, I have homicidal ideation sometimes. We have thoughts. It doesn't mean we act on them. But if they have a plan where they say, yep, I have a full bottle of morphine in my nightstand and I'm going to take it, or I have a loaded gun, or whatever, right? Believe them. And you cannot leave that person alone. You have to call, get help immediately, right? Let's see, what else? Older adults often fail to report abuse, true or false? Say it like you mean it. True. Yeah, it's true. Because they're afraid. They're afraid that their caregiver will get arrested, whatever. They're going to get in trouble. They're going to throw me in a nursing home. I don't know what's going to happen to me. And that's the end of this chapter. Tell me that wasn't a good time. All right. So until next time, everybody,